Gluteal Amnesia, or else dead bird. Recently, I happened to see my friend. He's an IT professional, team leader. He's learning a lot, but he wanted to make his physique fit. He says to me, especially due to this work from home, he's being in his home, sitting for a prolonged period of time, to say 8 hours, 9 hours. He has connected the laptop and the other things entirely interconnected. System, computer, and the small screen TV, the large screen TV. All these four things are connected. You know why? Psychologically, everything is connected. Wherever he goes, he is doing the same work only. So inside the room, he's doing all these things for his job only to make his physique fit. So I think I need to start walking. I said, okay, fine, let's start walking. Slowly, I wanted to go for jogging. I said, initially go for short walking first, 1 hour walking every day. After that, we will see. For the past 1 week or 10 days, he was going for walking, slow walking only, gentle walking only. He started with gentle walking only. But all of a sudden, for the past 2 days, pain, dull aching pain, which is starting from like back pain. Back, sometimes it's radiating towards my lower lip also. Previously, whether suppose when you are sitting previously, whether you are having this, he said no. But sometimes, very rarely, I used to get back pain just only at the back, lower back. Not like this, it's not radiating. It was not radiating. Now, for these 2 days or 3 days, I have this dull aching back pain. But the point is, it is radiating. So this is new to me. So I'm afraid of this. What shall I do? Like that, he started to ask me. Now, for these recent 2 3 days, he's not able to sit for 8 hours or 9 hours. That is his actual worry. Why? Because of pain. If he is able to sit, suppose if he's trying to sit continuously more than half an hour, this pain starts and it is to his hamstrings and below that also. This is the query. I started analyzing him and I found it very easily because of his posture. I asked him to walk. I asked him to stand. I know him very well. So it was easy for me to find out. But anyway, I give a clue. This is easy to find out the patient. Why I am teaching this now, yesterday only I have completed the gait analysis. I said about treadmill work speed. I told you one word finally or previously. Whenever you analyze a patient, you cannot say this is the only point they are having. This is the only this is the only thing they are having like that. We cannot say. We used to say Trendelenburg state. I mean, bilateral Trendelenburg state means they will go for waggling this side and this side. Along with that, you notice the patient, they will be leaning backward. This is a reality. This backward lean implies gluteal maximus muscle weakness. Lateral lean corresponds to gluteus medius weakness, and posterior lean corresponds to gluteus maximus weakness. So whenever the patient is having Trendelenburg state, we always point to gluteus medius, gluteus medius, gluteus medius. But along with that, we never understand or we generally miss out is gluteus maximus. Gluteus maximus is affected. Suppose if you are having your friends attempt to stand up, suppose if they are standing like this, leaning their belly in front and they are leaning backwards, trunk is leaning backwards, it indicates they are having gluteus maximus muscle weakness. How it is happening? Because, for example, my friend continuously for 8 hours, 9 hours, he is sitting. Whenever a particular muscle or particular region of your body is continuously under pressure or under compression, that may be because of your inner garments or maybe in tight dresses, for example, like jeans, underwear, or brazier, or continuously sitting for a prolonged period of time. Wherever you are having continuous compression or continuous touch by some other garments or some other objects, that particular region will go for weakness. It is for all the area, not only for goods. We are wearing undergarments tightly. That's not good. As well as we are sitting for a prolonged period of time. These two things will entirely cause those region weakness. Now we understand what are the weakness happening in our body nowadays and why it is related to us. You can understand easily. Especially we are speaking about gluteus maximus muscle. Dead bud, right? This is the basic problem with him. So I said simply, you go for exercise. For him, I taught just two exercises, very simple exercises, so as to activate the muscle. We can teach many exercises, but he is an IT professional. All of a sudden, I cannot put in heavy exercises on him. Just I need some simple exercises to activate them. So, okay, that's what only I'm going to demonstrate. Ask the patient to lift the hip. Can you lift the hip? Lift it little bit higher. Yes. Along with that, can you rotate your hip like this? Like this? Yes. This is going to be the exercise for better exercise for gluteus maximus. What is this exercise called? Pelvic bridging. We can lift it like this, hold it for 10 seconds and then drop. Again, okay, relax. Again, we can do it for continuously for 5 repetitions. Like this, we can activate the gluteus maximus muscle. This is an excellent and simple exercise. Keep the patient like this in a quarter position and then ask the patient to lift the leg and instruct the patient to go for lifting the leg without extending the knee joint. You have to maintain the 90 degree of knee joint. Plus, you are going to extend the hip like this. You can go for isokinetic like this for 20 repetitions, or another exercise. You can keep it like this and hold it for 10 seconds. Can you hold it for 10 seconds? Yes. It should be so straight. Hold it for 10 seconds. This is an excellent exercise for us. Okay. These two exercises, fine. Thank you. These two exercises can nicely activate gluteus maximus muscle. Right? So I taught him these two exercises and he is trying to do this. And for yesterday night, he called me and said, now the pain is little bit better. Of course, it is not fed away all of a sudden, but anyway, it is reduced a little bit. Now also he is going for walking. Right? Thank you.